Good morning. Good morning, everyone. Welcome to today's Board of Associates General Meeting. Um, just want to provide an overview of our format and, oh no, wait, we'll wait for, yeah, we'll do that. Some tech tips. So right now everyone has been muted, and that's to assure that we can all hear and experience a clear meeting today without distractions. We do have a number of speakers today, and you can review that agenda on our screen. Oops. Hold on. Pause. If you assure me that you are on mute, that should be in place for you. And if you don't do anything, then it will stay that way. So that will be good for us. Okay, I think we are in good shape now. Okay. So as I mentioned, you can review our agenda on the screen. We will have a break for Q&A between the two portions. So we will have kind of a leadership report, then we'll break for some Q&A, and we'll have another report from Dr. Tim Friel, and then we'll have a second round of Q&A. So if you didn't hear your question in the first portion, very likely it will come up in the second portion. You can also, if you're thinking of a question, have a question, you want to submit that to us, you can do that in the chat feature. Which we've been trying to highlight here in our opening time. You can find that functionality in the bottom right-hand corner. The button that says chat has a little chat bubble. And a number of folks have been, practicing and submitting their welcome and thanks. So that is also a place where you can submit a question, and I'll be able to see it, and then hopefully we'll be able to address it. I'll also, kind of go over this key information and drop that in the chat so that you can easily reference it. As I mentioned, for those on the computer, lots of folks are choosing to use their video. That's great.
I opted to go to browser.
Maybe some tech difficulties. If you wouldn't mind jumping on mute and send me a note in the chat, I'd be happy to help you with that. But at this point, I think we're set for now, and I'm going to turn it over to our Board of Associates President, Sybil Sturczyk, for some opening remarks.
Thank you so much, Erin, and thanks for helping with the technical details. I want to extend a special welcome to everyone, and thank you for being part of this special meeting. I have to tell you, I really have missed our regular Board of Associates get-togethers in April and June, and that's why I'm delighted to see you today, even if it's online. It's no surprise that Lehigh Valley Health Network has been busier than ever, and I want to acknowledge all employees for their dedication and the extraordinary work that they have done in keeping our communities safe, taking care of us during this pandemic. Equally important, the network has and continues to be a trusted and reliable source of COVID-19 information. Now, in our role as advocates for the network, we can do our part in safely sharing this valuable information, whether you do it by phone, social media, or email. We can share this information to keep our family, our friends, our neighbors, and work associates well informed. And together, we can help the network keep our communities safe. So again, thank you for being here. Delighted that you're all here. We're up to almost 80 people. At this point, thank you again. I'm going to turn it over to Erin for some brief announcements before we hear from Dr. Nestor and the others. Thanks again.
Thank you, Sybil. Yes, just a few operational notes for Board of Associates members before we get started. First, we just wanted to mention regarding membership renewal. As you can imagine, given the disruption in our regular season of programming, our membership renewal process is going to look a little bit different this year. We're going to streamline that process so that all 2020 members will be automatically renewed into 2021. So you will still receive a communication from us that will give you the opportunity to update your contact information, or if you would want to decline that renewal, but we will assume that we will carry you forward into the new year unless we hear from you. Secondly, I'm pleased to share, and you may have been wondering, why does Erin keep talking about masks? Pleased to share that all members of the Board of Associates will be receiving a special gift in the mail in the coming weeks, so please keep your eye out for your very own, very special LVHN face mask. So you may have seen these in the community, but now you can be sure to have one of your own. All right. with those announcements, we can now start our formal program with Lehigh Valley Health Network President and Chief Executive Officer, Dr. Fran Nestor, and Terry Capuano, our Executive Vice President and Chief Operating Officer here at LVHN. So Dr. Nestor, I will go ahead and unmute you, and we will go from there. Oh, looks like you're all set.
All right. Hey, thanks so much. I just really want to thank Erin for her coordination, Sybil and the leadership of the Board of Associates for pulling together. It's a brave task. You know, a lot of people talk about, oh, let's just have a WebEx and we'll all get together. And you've all, I imagine, participated in some with maybe family, friends, or work. But this is one of the largest WebExes I've been on since the beginning of COVID, just to let you know. So kudos to the Board of Associates for pulling that off. It is not easy. By the way, by now we would have been yelling at about 50 of our executives for not putting their mute buttons on. So you're doing much better than the average exec here at LVHN. So really excited to have Terry with me on this panel, as well as Tim Friel. You know, Tim's been a real expert, and everybody, if you didn't know Tim before COVID, everybody knows Tim now because of COVID. You'll see him on billboards, and he's been on television a whole lot. And somehow he's kept his head in the right place. Wonderful guy. We'll defer all hard questions to Tim. Terry has been instrumental in keeping the operation running, which is completely transformed since the last time we were together. Completely transformed. If you've sought any kind of medical care in any location, whether it's your office practice or one of our office practices, our health centers, express care locations, had surgery, had to come to the hospital, everything is different, right? To actually move a colleague workforce of 20,000 individuals on a consistent path to do things differently in a few short weeks, it is an enormous undertaking. You know, so I look forward to Terry's comments. That's for sure. So I thought I'd start with some high level kind of commentary, maybe almost a little reflection on, you know, what happened. It feels like I've been to the moon and back like 8 times since we were all together. And that's not me, it's everybody working at LVHN and frankly, all of our communities. So when you think about this and you go back to the sentinel moment, we had a board meeting on Wednesday, March 11th. Small little anecdote. In the afternoon, it was a retreat and we had external speakers, and it's usually our senior executives or senior vice presidents and our board members. We do this once or twice a year to give an update on what's going on in healthcare. And suddenly around 2 o'clock, a couple people's phone went off and they left the room. Then 5 people were gone. Then I'm looking around the room like, why is everybody leaving? Except for our board members. Didn't look good, you know. As it turned out, at the end of the meeting, we found that the Network Emergency Operations Council that had been activated, we have a council like that that's always there, ready to be activated, was activated 2 days prior on Monday, and they were surveilling the situation on COVID, and by Wednesday had determined this is a major threat to our organization, and we're calling our leaders out to start mobilizing. That was the last big meeting we had in this network, was that board retreat that day. The next day, we mobilized a brand new group called the CEOC, that's the CEO Council, that was working with the Network Emergency Operations Council, NEOC, to try and coordinate on a daily basis, twice daily basis, for what would be the next 2.5 straight months, 7 days a week, changes in how we care for patients. I cannot tell you, I mean, this is my 21st year here, 22nd year here. I cannot tell you how proud I am of how this organization responded. They responded, all of our caregivers, frontline, back office, support staff responded to the tens across the board. It was remarkable to watch. And as a result, I would tell you, LVHN is stronger than almost any other organization, frankly, in the country. And I'll get to why I believe that. So it was one heck of a journey. What were the big challenges? Well, certainly the biggest challenge was making sure we had PPE. We had the right protective equipment for our staff, but also we had enough to take care of patients. So keep in mind, we were changing protocols sometimes on an hourly basis throughout each week. And our supply chain folks did an extraordinary job. We were down and sweating it in a couple areas like eyewear, where we were down to single day stock on hand, taking care of patients. Very scary. We were down to single digit days stock on hand for critical medications. We were at one point almost using every ventilator that we had at each campus. LVHN was fortunate though. We got hit hard, but we didn't get hit so hard that it overwhelmed us. We got stretched, there's no doubt about it, especially in critical care, but we didn't get overwhelmed and the team really pulled together. So what happens if you're in a situation like that? Well, your outcomes are great. I would tell you that our mortality for COVID-19 patients is about 1/4 what it is nationally. We feel really, really good about that. Our critical care mortality is excellent. We did extraordinary things and had extraordinary saves at all of our campuses, Hazleton, Schuylkill, Pocono, and also at Muhlenberg and Cedar Crest. So very proud of ourselves there. And the team really did a great job. But what else matters in times like that? So we're giving great care. We're protecting our colleagues. But what about the community? Marketing zipped up. We actually, when we were trying to salvage our financials for the year, we actually invested an additional $2 million. And I know Rich Levy and Pam Riddell and some of our other marketing execs are on this call today. Spent about $2 million on community education. All right. Wear your mask. Pay attention to social distancing standards. And I would tell you, I think that was a key in keeping the rate of COVID-19 spread in our community low and preventing us from having to be overwhelmed. So, marketing really pulled it out. I see also with us today is also Mary Terrell, our Vice President of Government Affairs. Mary was working 24 hours a day because we really had state leadership that needed input from leadership, healthcare leadership. And Mary worked tirelessly to make sure they got our messages across about what we needed to accomplish, what types of assistance we needed to make certain we had testing kits for COVID-19 testing, to make sure we had stockpiles of PPE on the way. By the way, most times it didn't work, okay? But when it did work, it was really a godsend. So we thank our government affairs group as well. All of this in addition to our clinical folks. So finally, I would say that finances. Let's go there, right? When you have a high fixed cost organization like we do, and you suddenly shut the engines down, those fixed costs don't go away. They're there. You really had to react, I feel, in a very aggressive manner. We looked at this once in a century global calamity and said, we're, I suppose, the poor suckers that are here right now, trying to make sure that this glorious collection of community assets, Pocono, Hazleton, Schuylkill, hospitals in the Lehigh Valley, don't go under while we're here. And I would tell you, the team pulled together. But I would tell you that the outcomes, and this is where I started earlier, that we're probably in the top decile in the country in terms of how we responded clinically and financially, which is very important because we need these community assets to still be alive and well when COVID is gone. All right. We were aggressive in some of our plans. Just some quick statistics. We took 18% of our overhead out in 4 weeks. We were in the middle or near the end of a 33-month engagement, 33-month engagement to take $250 million of expense out of our company. We took another $130 million out in 6 weeks. We found ways to reduce our expenses. By the way, I would tell you that 90% of that was non-wage expenses. All right. So in terms of taking people out of action, while for a short period of time, we had as many as 4,500, 23% of our overall workforce was furloughed. okay, for a short period, we only lost about 150 to 200 permanently displaced colleagues. And I would tell you that, that's actually less than most organizations out there. You've heard organizations like Tower Health to our south in Reading that announced an initial layoff of 1,000 colleagues, and they're about just 2/3 the size of us. So I think that how we navigated it, how we took expense out aggressively and could keep jobs and bring people back to work fast was the key. Our financial performance, we ended the year, and our GAAP accounting rules require us to include the CARES Act dollars we were given. So including the CARES dollars we were given, we actually made a 2.7% operating margin this year, when about 90 to 95% of hospitals lost dramatic amount of money. So we're very proud of that. And why is that important? Because we can continue to function. We can continue to fund our plans. We funded our pension plans and never stopped during COVID-19 in our year, putting $95 million into our pension fund last year, despite COVID and the interruption there. And we've been able to make some recent announcements about what we're going to do for our colleagues, not only in the short term, but long term. A, we funded the pension plan and made sure we didn't drop a beat there. B, we made sure we matched all 401k contributions, didn't drop a beat there. We've announced a 2% merit increase for all of our colleagues, for those that are eligible. We've also given, recognizing the physical and emotional aspects of COVID and how they've affected our staff. We've given all full-time staff an additional full 8 hours of paid time off for wellness. And we've given 4 hours to our part-time folks as well. So A, we're able to invest in our colleagues, our most important asset. B, we were able to continue doing our major construction projects. You may have noticed or not if you were by Cedar Crest or in Northampton County, we didn't stop hanging steel in Northampton County. We didn't stop with our emergency department at Cedar Crest. And we just had our board meeting yesterday, and we actually have approval for 6 more major projects. We are on track. Terry can give a little bit more about that. So isn't that wonderful how you did that, Aaron, and pulled that slide up? You're awesome. So I'm just beaming with thanks and pride for what this group of organization, this group of colleagues, 20,000 strong at LVHN, did across every single market. I had the opportunity during the heat of the crisis to visit every ICU, every emergency department, all the COVID floors, and by the way, and went home to my family at the end of the day, because if you follow the rules, you can stop the spread of COVID-19. Okay, you wear a mask, you wash your hands, you protect yourself. All right, and you can be safe. You really can. That was a message we really needed to give, especially through marketing to our community, that once the coast was kind of clear and we were clear we're not going to get overwhelmed, and the state allowed us to reopen our elective cases, people needed to feel confident that they could come back for care and not worry they were going to get COVID-19. The spread of COVID-19 among 20,000 colleagues is less than 1.5% of our entire staff. I mean, it's remarkable how we contained the spread. So I'm proud that we did great clinical job. I'm proud that we kept our finances intact so we could still invest in our people. We can invest in those major projects that need to go on for our community to have better access and a better experience. And I am just so proud how people rallied together. By the way, it's not over. I mean, it's so funny. We have all these executives. You might see some of us in our office or wherever, but we take WebExes right next to someone else in another office because we don't want to be together. We actually have all sorts of rules on how close we can be. And if I'm out of this office or near anyone, we're all wearing masks. But while life has changed, I think the one thing I would ask you is to, as I talk to people in the community, is I know we're burned out at this point. A lot of people are burned out of this. All right. You've done all the takeout food 9 times from the same 4 places, right? You're about tired of not seeing loved ones and giving a hug. it's time to dig deep because this is going to go on for a while. All right. It's just the reality. All right. We can do this. People have proven, you have proven you can do this. We're just going to have to dig deep for a little while longer. And, I think maybe Tim would be best, Dr. Friel, to share with us, his view on, vaccines and other treatments and when, things might improve. But it's suffice it to say, we are planning for the entire fiscal year of 21 through June to really be impacted in some way by COVID. So with that, I'll stop and happy to take any questions, or Aaron, if you want to jump into Terry, and then we take questions. You're the boss.
Oh man. Yeah, if that's okay, Terry, why don't we work through your slides and then we'll see, what we had for Q&A.
Okay, thank you. Thank you. Good afternoon, everyone. I'm so delighted. Every time I'm in front of this group, I tell you, you are my most favorite group because of your support of LVHN. And I want to go through, and I'll go through it rapidly. I wanted to go through a couple items about how we transform to meet the needs of our community and what the community did for LVHN. Next slide. I'm going to pick up on Dr. Nestor's theme on our next slide of how proud we were. And what I have pictures here of our staff holding signs, thanking our first responders who drove by every campus, long, large parades of fire engines, emergency ambulance vehicles, their own vehicles, thanking us for what we were doing. And we, in turn, were thanking them, our community members, for bringing us those patients for which we could provide care. And on our next slide, I am just going to talk about how we were setting a course for the future and how we are changing what we are doing so that we can respond to this pandemic or any emergency that happens in the organization. On the next slide, Dr. Nestor mentioned that we began our Network Emergency Operations Center. We began that on March 9th, and everybody has their thumbs up in the center, but that center served as our hub, as our nerve center for everything we were coordinating with the community and what we were coordinating throughout our entire network. As you can imagine, none of us had experienced a pandemic before, and we were consulting our experts, talking to leaders in the community. We were developing policies and procedures and so on in the moment. And many of us refer to this as, while we were driving the car at 80 miles an hour, we were also building the engine to go with it. On our next slide, Dr. Nestor mentioned about how we stockpiled our equipment and supplies. And we had rooms, conference rooms that you're normally in, filled with supplies that we were getting from all of our normal suppliers and every other vendor that we could connect with. Because as you see on the right-hand side, that is one of our ICU hallways. Our ICUs were filled with not only sick COVID patients, they were so sick that every one of them basically was on the ventilator, and they require a number of drugs to manage them as well as supplies. So not only are we doing today, or before, I should say yesterday, to make sure that we had enough supplies to care for patients, but we are also doing it for the future. Should we have a resurgence of this as there are predictions in the late fall and early winter. Our next slide shows us our COVID patients and the number of patients that we had in all of our LVHN hospitals. And when you look at that at our 5 major campuses, you can see that we went as high as about 260 in our hospitals and then began to tail off. As we continue to see people in our community practice social distancing, practice hand washing, practice mask wearing, we are predicting that we will be down to 0. As of today, we have about 30 patients in all of our organizations, which is wonderful. We have a number of people on our next slide that were on the front line. And by being on the front line, as Brian mentioned, there were over 4,000 of our colleagues that were furloughed. However, there were some of them that we redeployed so that they could screen patients, that they could screen our own staff coming to work. There are a number of people that were working from home and had to turn on a dime, get the technology they needed, and work from home. So many people were working very differently. And then, of course, we have every one of our first line, front line people, our doctors, our nurses, our technical partners, but not only them. There were also people making sure that everybody was fed, that food that the community delivered to us were getting to our frontline workers. There were people that were delivering supplies and preparing medications. There's so much that goes on behind the scenes to make a hospital run. And we made sure that we not only recognized our frontline caregivers, and you always think about the doctors and nurses first, but that we also recognize all those people behind the scenes that were working to make sure we had the supplies, equipment that we needed to take care of patients. Additionally, on the next slide, we made sure that we kept not only our employees informed about, and truly the communication was rapid, it was constant, and we were developing it as we go along. But we also wanted to make sure that our community was educated about what was happening, as well as educated about the disease itself and how to stay safe. So you'll see on the slide, there was just a number of areas in which we had print ads, and we're on social media constantly. We did billboards, we did emails. We really wanted to get out to our community to stay constantly in touch with them so that they felt informed, because information ends up reducing anxiety about what we were experiencing. Also on the next slide, we were caring with our technology, and we were able to have 24/7 technology support. We distributed 1,100 iPads to our patients so that our patients could stay in touch with their loved ones, with their family members. It was very difficult for them. And we had all of our frontline caregivers, people that were in extra to help. We had them all working with our patients so that they could stay connected. We also had a number of dashboards. We wanted to make sure we were on top of our metrics. And so we had a number of dashboards that we could drill into. Dr. Nestor mentioned, how were we doing on masks? And we had a dashboard that enabled us to determine how many days of stock we had, given our current utilization of procedure masks and of our N95 masks and of our gowns and eyewear and so on, because we needed that information right at our fingertips and right in the moment. We also, on next slide, we kept up with our community health, with our technology. We stayed in touch with our community. We had a number of video visits. We had ways for our community to engage with their physicians, a number of ways to engage in express care. We have patients that we monitor all the time through video and through audio, and stay on top of them and manage their case with them. And we continued that and expanded that during this time. Likewise, we had a number of our community members work with us in terms of the support for the community. If you look at, Erin, if you would go to the next slide, please, I believe. There it is. We had our community support. We had our colleague support. We had a number of things in place because our colleagues needed the support of our Department of Psychiatry. We needed our physicians to have peer-to-peer support. We needed some mindfulness training because dealing with this level of intensity day after day after day, and this level of unknown of when this would be over, we made sure that our staff had mindfulness training as well. And we had employee assistants working with our staff and making rounds to our staff to make sure that they were okay. If we could go to our next slide, Erin. We also then, once we got through that acute period of time, we also then began to recover. And again, we used our dashboards to monitor our performance. But within a weekend, truly, from the time we said it is safe for us to reopen, we have all of the protective measures in place. We have all the distancing in place. We have all the cleaning and hand washing and mask wearing and so on in place. It was time for us to resolve and revive our operations and assure our community that we were able to care for everybody. And one example I can give you is screening mammography, for the most part, totally shut down. And within a weekend, we were back open, and now we have all of our women that feel comfortable coming back because of the things that we have put in place to care for them while they're getting their screening. We didn't want people to put off, and we had heard stories about this. We did not want people to put off their care for fear of catching COVID when they came into our facilities. We wanted to assure our public that our facilities were safe. Next, please, Erin. And then we had our community support. Our community was, you almost can't describe it. People were calling and delivering food, snacks, treats. We were informing our community of what was going on. They were donating, and one of the most amazing statistics is 80,000 masks were donated. People started sewing. They didn't know what to do, and they began sewing masks for us, for our families, for our community, and delivering them to us so that we could begin distribution throughout our community and to our own people, so that our caregivers could keep their families safe. Additionally, we had, and one of the supports for our colleagues is our daycare was open during this time, because not only do we have one person from a family working in healthcare, we had both, and they were able to have their children be safe while we were caring for our community. But I can't thank our community, and many of you were involved with us. I can't thank you enough for the support that you gave us. Erin, next. I think that might be my last. It is. So thank you again. Thank you for the opportunity that we have to share this story with you. And thank you for listening and understanding how we participated with you, but importantly, how you participated with us to deal with this pandemic that we've never experienced before.
You know, I want to, Terry, I want to just jump on your last comment there about how the community responded. I see that Jane Risley, our Vice President for Philanthropy, is also on this call right now, this WebEx. You would think it wouldn't be a good time for philanthropy, perhaps not in the typical way philanthropy maybe asks for donations, financial donations. But boy, oh boy, they transformed their Office of Philanthropy into a different kind of Office of Philanthropy, and that was receiving all these donations and making certain that meals that were delivered were getting to the right units and getting to everyone, and helping to catalog. I think half the time they were supply chain agents working for supply chain. So I want to give kudos to that portion of our organization as well. But that was a labor of love to get all those donations from our community. So I wanted to give one more shout out to the community. Thank you. Erin, back to you.
Oh, well, thank you. All right, we are about halfway through our program. We did cover some of the question topics actually in the discussion in terms of support for colleagues, that ever looming question, when, might we respect a return to normal? But maybe if we can address one question, and then we'll go to Dr. Friel's portion, and then we'll use the balance of time for questions. But in terms of, return to services and the work that's being done through EROC, any perspective at the network level on kind of the continuation or the growth of telemedicine and how that might be a part of the patient experience moving forward?
Yeah, I'll jump in, and maybe along the way, Tim or Terry will have other comments. But yeah, so in the height, imagine this: LVPG, Lehigh Physician Group, sees about 10,000 patient visits a day. They ended last year at about 3.2 million visits. So really a very busy organization, right? So when we shut down services, we literally merged about 150 practice locations into about 150 practice locations. So we actually cut our practice locations in half and had different practices working together out of the same facility, because we really didn't have people, we didn't want people coming to hundreds of locations. We wanted to centralize them into locations where we had enough PPE, if you will, and process in place to care for people face to face if they needed a face to face encounter. However, I would tell you, we really got to the point where we were up to about 6,500 cases a day. Most of those were not face to face. They were either virtual visits by video or e-chat online or phone visits. So I'll tell you, our physicians, our advanced practice clinicians really stepped up, took technology to a different level. Kudos to IT. They really, in about 8 days, they invested another $1.5 million in our platform to allow for that capacity to do that much online visitation. And now, what have we seen? Where it was really almost about 60% of visits were by some digital means or phone. We actually are down, as I'm told most recently, to about 15 to 20% of our visits are now down to that. But we see, but by the way, pre-COVID, it was less than 1%. So will it last? Absolutely. We were doing about 90 video visits a month, and we are now averaging close to 2,000, 2,000 a day. It is unbelievable the number of video visits that we can accomplish on busy days. So where are we going to go? I think that we're going to see it settle out a little bit, because as people had the opportunity to use it, some people will prefer to do it that way, and others will rather get back to the office. We're estimating that this will settle out somewhere between about 10 to 15, at the highest end, 20% of our visits. By the way, if we can move that many patients to a virtual setting, that's a good thing, because we're moving certain visits to that setting because they can easily be accomplished. I don't have to go to the doctor every 6 months to have necessarily a rundown of my medications and a rundown on how I'm feeling and doing. I can have that as a quick e-chat or a quick video visit and be on my way. And by the way, we're going to make those visits lower cost. And then if we can backfill that with other people that are waiting to get into our practices, it's a win-win all around. So I think it'll be there. We're not sure about how much of our daily practice, but somewhere between 10 and 20%.
Great. Thank you so much, Dr. Nestor and Terry, for your presentations. At this time, it is my pleasure to introduce Dr. Timothy Friel. He's our chair of the Department of Medicine, an infectious disease specialist, and he'll be providing us even more detail into insight in LVHN's response to COVID-19. So Dr. Friel, if you are ready.
Yes, indeed. Thank you, Erin, and appreciate your invitation to join today's proceedings. Thanks to all of you for participating today. We greatly appreciate your interest. Just as a follow-up to Brian's statement, I agree. I think from the start of this epidemic, we have been working tirelessly to define the new normal. And COVID has been tough. Don't get us wrong. And if we could wish it away, we certainly would. There are some good things that have come out of that, and we'll touch upon some of those today. And I agree with Brian. Telemedicine, I think, is one of the good things, and in the right place, in the right time for the right patient, it is an exceptional platform for providing care. So we'll go next slide. There we go. So Erin asked me to provide an overview of LVHN's response, and some of the things that Terry has touched upon, I will go through fairly quickly. When asked what are the things that I'm most proud of as far as LVHN's response, I came up with 6 themes. This is clearly not all inclusive, but the things that I'd like to approach today and give a little more detail is our testing and assessment strategy and the development of our testing sites, our inpatient response and surge planning, the innovations that were put in place in a record and rapid period of time, our extreme focus and extreme commitment to colleague safety and support, our devotion to community education, and our realization about how important that was going to be to not only our success as an organization, but our community's success in navigating the uncertainty of the COVID pandemic. And then finally, the return and recovery that both Brian and Terry have talked about as well. Next slide. So one of the first, and I think perhaps one of the most important things we did as a network was made a decision that with the onset of cases within the United States, we needed to be ready. We needed to prepare our community. And I will not forget those days in early March when we came together and recognized that the world was changing and it was going to be changing quickly. And in a very short period of time, within 48 hours from making the decision that something needed to be done till actual execution, we had developed standalone COVID testing and assessment sites across every county that we serve. And that literally happened within a 48-hour period. So 3 days later, we were up and running with the availability and availability of testing in all the regions that we served. I really do fundamentally think that the institution and the launch of these testing sites were not only instrumental in raising our community's awareness about COVID pandemic and the importance of making changes, but it also helped us, both within LVHN and healthcare and public health leaders across the state. It helped us better understand the local epidemics that would continue to unfold. So very, very proud of that. We rapidly identified that cases were starting. We demonstrated the onset of community spread, and we also recognized some early hotspots. First in the Pocono region, the hospital and campus that was impacted first among all of our campuses, and then later the ongoing and very significant pandemics or mini epidemics that we saw in the Hazleton market and then in Lehigh and Northampton counties as things moved to the south. I do believe that the testing and assessment sites that were set up solo and isolated from anything else so that people with symptoms were not commingling with others really became a model for programs both within our region, throughout our state, and across the country. Next slide. When you look at our statistics, and this is data as of September 4th, we had completed almost 91,000 COVID-19 tests. Of those tests, 8,473 were positive, giving us an overall positivity rate of 9.5%. At the peak and at the height in late March and early April, we were seeing days with positivity rates through our COVID testing programs as high as 33%. So that reflects just how rapidly and extensive the disease was in many of the communities that we were serving. Next slide. This just gives you an overall perspective of the tests that we've done. On the top, it shows the number of, this is the number of test result reports that we've gotten back on a single day. And not every day's number is quantified there, but you can see at the peak and the height in late March and early April, we had one day where we had identified 442 new COVID positive cases across the region that we served. And we had people coming not only from the many counties we serve, but from outside, recognizing that we provided some of the best and earliest access to COVID tests in Eastern Pennsylvania. If you look at the bottom, this gives you our positivity rate on any single day. And as you can see in the peak of things when we were testing, and albeit restricted testing to those who had symptoms, which was the norm for testing programs across the country in the early parts of the epidemic, you can see the high positivity rates that we had in our programs. Now, as you flash forward to where we are right now in September, our positivity rates have been hovering at 5% or less. Next slide. The next thing I'm incredibly proud of is the colleagues that I've worked with both in my department and the other departments that we interface with very carefully on a collaborative and multidisciplinary approach to prepare for the onslaught of patients who are coming from our community into our hospitals to receive care for COVID-19. And thankfully, we had a fantastic multidisciplinary team at LVHN, and at what I'd like to call a very deep bench of talent. That included my colleagues from infectious disease and infection control, pulmonary and critical care medicine, respiratory therapy, nursing, our disaster response team, our supply chain management team, our pharmacists, our employee health colleagues, and so many others. It would literally take me over an hour to sit back and thank people for their remarkable contributions over the last several months. Next slide. Just to give you perspective, let's see, there we go. This gives you a look at our inpatient curve. And you know, as Terry had shared another visualization of this a little bit earlier, this gives you the mark of, you know, at our peak, across our system, over 270 individuals throughout our hospitals in all our regions, our inpatient rehabilitations, our transitional sites, et cetera. Now down to where we are at just shy in the 30s, as Terry had mentioned. At our peak, we had 63 ventilated patients across our system on a single day. Now we are down to 4 or 3 patients. We did have one day where we hit 0, and we did acknowledge that appropriately and you know, celebrated the contributions of all our staff to helping us achieve that goal. Next slide. One of the things I've been most proud about, however, has been the innovations. And there are so many. And just to highlight a few, our AICU, the Advanced Intensive Care Unit that we run, that allowed us to provide virtual care from afar to every ICU bed across our network at every campus. We had critical care trained physicians at many times throughout the day, 3 at one time, who were manning every patient beds from a remote site on Lehigh Street. That helped us assure that our boots on the ground care could have this extra layer of protection to provide optimal care and ideal outcomes for our patients who were facing critical illness. We provided innovative ways to provide inpatient consultative services using iPads, virtual means to connect with different campuses, and ways to connect patients to family using iPads. So great respect for my colleagues in our connected care program who helped us with that. In the outpatient world, we transformed to virtual care, and I'll show you that in a little bit, as Brian had suggested. Within a week, we created COVID on-demand video visits so that those who were seeking assessment for symptoms could do so with just the touch of a button on their phone, their iPad, or their computers. We developed a LVPG 24/7 nursing hotline as a way for anyone in our community to connect with our nursing resources to provide advice, guidance, and triage patients appropriately. We soon developed a COVID clinic, a resource for folks who had been diagnosed with COVID and were experienced transitions of care outside of our hospital so that they could do that remotely, not only with primary care physicians, but specialists. An elaborate remote patient monitoring program allowed us to monitor temperature and oxygenation levels for our patients who were managed at home. And a test result service allowed nurses within our network to contact and share results and education with every patient who had received testing services from us. Next slide. As I mentioned, our extreme focus on colleague safety and support was paramount right from the start. And that was reflected in our aggressive plans for personal protective equipment for all our clinicians. We made a decision very soon, and probably in advance of most healthcare institutions, that we were going to put all our patient-facing healthcare workers in appropriate PPE. So we decided, based on early data and our early experience, that you could no longer judge by symptoms or how a patient looked whether or not they were at high risk for COVID. We were starting to respect the reality of asymptomatic or pre-symptomatic carriage and made a decision very early in March to put all our patient-facing colleagues in PPE. We also really developed a culture where social distancing, rigorous hand washing, aggressive communication and education, all of those things became fundamental components of how we treated each other and how we provided care and respect for each other within the workplace. We really worked to change the culture and make sure that everyone, when they came to work, was fully committed to doing what they could to reduce the spread of COVID-19, both within our workspaces and within at home. And our continuing education, keeping all of our colleagues informed and updated, was so incredibly important to our long-term success. Next slide. That communication, though, extended also to our community. And I was very, very proud of the number of our colleagues who represented LVHN, I think, proudly, and represented the communities where they live proudly by appearing on television, in social media ads, in the newspaper, educating our community, dispelling myths, and really helping people understand the pandemic as it was unfolding. And I'm also proud of our marketing, where we were incredibly focused on the safety of our community, on the education of our community, and doing everything that we could to have an informed community. And I do agree with Brian that those efforts really made a difference in keeping us safer and reducing unnecessary spread during the months of March and April and beyond. Next slide. And finally, one of the things that I've talked about, we recognized very, very early that we were not just facing one pandemic, COVID-19, but also two others, the pandemics of fear and the very important pandemic of misinformation. And both fear and misinformation abound. And so the world of social media and our easy access has changed things. And in some things, it's been a great, great tool for us during the COVID pandemic. And in other cases, with the rapid ability to spread misinformation, it's been a challenge. So that's why our educational efforts and our marketing efforts, I think, have been so important and will continue to be important as we move forward. Next slide. As we continue, though, this was our early response. We recognize a fourth pandemic has begun, and that is one of fatigue and complacency. And certainly we see it. We see it in our communities. We see it in our family members. We even see it in our colleagues. We all want this to go away. So I think recognizing this is the first step, and continuing our efforts to educate, to guide, to support our colleagues and our community through this fourth pandemic, I think are going to be equally important to our success in the coming months that lie ahead. Next slide. And just, return and recovery, I'm incredibly proud to have been part of these efforts. As Brian said, we did the right thing in the beginning. We shut down. We really closed access. We consolidated practices. But when we learned more about the pandemic and were able to operationalize tactics that would allow us to return to care and do so in a safe fashion, we did so with great, great rapidity. And this slide just gives you a clear look at how we've done. And it outlines kind of where we were prior summers and in the months January, February, and March before the pandemic hit. And you can see the rapid drop from 10,000 down to about 6,000. But those green bars represent the transition from blue, which is face-to-face care, to digital. So virtual encounters and telemedicine and using other modalities. And you can see that we quickly went to about 70 to 80%, and some days even higher, virtual care. But when we knew that we could provide care safely, and we recognized the impact that not coming into the office was having on outcomes for other conditions like heart disease, stroke care, cancer care, et cetera, we recognized closing our hospitals and physician offices was not a long-term strategy for success. And our community needed their healthcare system to return, but do so in a way that was keeping them safe. Next slide. And so I'll end like Terry did. Pictures mean everything to me. And I think this is just a way to celebrate and acknowledge. It takes a village to do great care, and it's certainly a village that I've been proud to be part of. I look across with great pride at the impact and the contributions of my many colleagues who serve in different areas, both within my department, in the other departments. We came together. So if anything, I think our legacy in the days that we will look back and cherish, how COVID, despite the fear, despite the uncertainty, and despite the rapid changes, it brought us together, united in our resolve to do great things and deliver great care for our patients and to protect our community as much as possible. So next slide. It truly has been a remarkable time to be in healthcare, and I'm really proud to have gone through this experience with the colleagues here at LVHN. So that's all I have. And, Erin, I'll turn it back over to you for questions.
All right. Thank you, Dr. Friel. I will bring the presentation down just so we can all see each other. First question, multiple questions that came in on this front are related to the development of a vaccine. and particularly what role is LVHN playing in potentially being able to, support bringing a vaccine to market?
Great question. And certainly right now, the quest for a vaccine is perhaps one of the new holy grail, the quest for a new holy grail. So the vaccine effort is alive and well and in full force across our country, internationally, and even here at LVHN. As many of you have heard about Operation Warp Speed, which is the American efforts to develop a vaccine, there have been several vaccines that have been targeted. One of them is developed by Pfizer and BioNTech, and I'm proud to say that we are a participating research site for this clinical trial. To date, we have already enrolled 27 individuals from our community who are participating in this trial looking at that vaccine. This vaccine work is going to continue over the next coming weeks and months. We are all very, very hopeful. As a scientist, though, I'm also trying to balance our great desire to have an outcome with making sure that we achieve those outcomes and have good data that will really support the efficacy, the effectiveness of the vaccine, as well as the safety of those vaccines. So for us, this is the balancing act. I am optimistic about our abilities, and I think we're going to be able to turn things around in a faster way than we ever have before for any other infectious pathogens. But I do remind people that there is a process, and to do this effectively and safely, we need to go through the proper channels to do so.
Great, thank you. On kind of a related note in terms of vaccines, we also received multiple questions about how important is it for you to get your flu shot this year? And also, when should you get it?
Yep.
And how can you get it?
Yeah, so it's a great question. And I will tell you, I always look out for things that people in our community can do to help. And I, as Terry had shared, we have just been overwhelmed with the response of our community. How can we help? So whether it's making masks, doing your part, wearing your mask, social distancing, all great. Another thing that I tell people that they can and should do is get their flu shot. The worst case scenario for us is an increase or a surge in COVID-19 as we move into the cooler months of fall and winter. If that happens at the same time that we see a surge or a simultaneous epidemic of influenza, it can be really, really disastrous, not only to our community, but to any community throughout the country or throughout the globe. So influenza, we do have a flu vaccine that is effective at reducing risk of not only getting influenza, but if you do get it, it reduces the likelihood of severe disease. So it's something that everyone can do, and I ask everyone to be advocates for flu vaccination and be really supportive of those efforts.
Perfect. I think I have time. I think we can squeeze in a couple more questions. This question is for any of our panelists who would like to answer. Related to testing and turnaround times for testing. So any update on response time for test results, both for those who are being tested who are symptomatic and maybe those that are being tested for surgery or school?
Yeah, so it's a great question. So I'm happy to take it, and Brian and Terry, if you have other comments. So this has always been a moving target, and I want to be really upfront and honest with folks. There are things that are in our control, and there are things that have been out of our control. Our goal, so our partners at Health Network Labs, really, so with in-house testing, in most cases, they've been able to guarantee about 48-hour turnaround time, so 1 to 2 days after the specimen arrives. So you have to remember that, there's where your specimen is obtained and then getting it back to the lab. We also, when we go over our internal capacity on a daily basis, we utilize partner labs like Quest and ARUP to help support that. And even those national labs right now are assuring turnaround times of 2 to 4 days. Now, the challenge we have had, not only locally, but nationally, is that we are sometimes at the mercy of supply chain. And we have found ourselves in a few circumstances where we have all the tools and materials that we need. But because other regions of the country are in dire need, or had run out of supplies, that supplies that we had or other labs had were redirected and taken from us to go support testing efforts in harder hit areas. So this happened over the summer a few times to support southern areas. So that's where we are. I think when everything is going well, it's about a 2 to 3 day turnaround time. But sometimes that can change. At its worst, it's been as high as 7 days, but we're doing our best to keep that number as close to 2 to 3 days as possible.
Okay, great. I see that we're right at time. We did have one more, if we can maybe just quickly address Dr. Friel, because a number of folks were just asking about LVHN's role as it relates to return to school and
Yes.
how we're supporting the schools during this time.
So it's a great question, and we have been partnering with many of the if not all of the school districts on some level. Many of my infectious disease and infection control colleagues, as well as our occupational health and our pediatrics colleagues, have been involved in many of these discussions, not only helping those schools that are doing face-to-face care or even doing face-to-face to help develop their plan, keep their colleagues, their students safe. Also being utilized to support. I'm sorry, we're getting a little bit of feedback.
I'm looking for it. Okay, looking for it.
There we go. So we're doing everything that we can to also support some of the regional school districts as well as the regional universities with their plans. This has been a tough period of time for the healthcare industry. It is certainly a really challenging time, not only for the academic industry, our grade schools, our high schools, our universities. It has been really tough, as well as on families, parents, and our students who really need to get a great education. And so we're doing everything possible to help support and navigate during this period of time where there's still a lot of uncertainty and we're still learning. This is our first time really navigating a school year in the midst of a pandemic. So it is an ongoing work in progress.
Perfect. Thank you so much, Dr. Friel. At this point, I did see there are a couple questions we weren't able to address. I'd be happy to follow up with those members, or maybe we can do a summary for folks that have joined us today. But that does conclude our formal program. So I want to thank you so much to each of our presenters, and of course to each of you as members for joining us today. We will continue to keep you informed of the latest updates, and of course we want you to continue to stay healthy and safe throughout this time. So I hope everyone has a great day.
Thank you all, everyone. Thank you so much.
Take care, everyone.
Thank you.